Hi, this is Dr. Ray Benedetto, and I want to welcome you back to the next video in our series here on how we effectively and naturally treat fibromyalgia. We're going to go ahead and dive right in with success secret number 7, treatment success secret. What we're going to talk about is polycystic ovarian syndrome. Very common. We see this in our patients all the time. They come in with a long history of ovarian cysts and those kind of things. There have been studies actually that show that PCOS, or polycystic ovarian syndrome, can trigger autoimmune diseases, things like Hashimoto's, which is an autoimmune disease of the thyroid, which we've mentioned in the past. PCOS is a pretty common female hormone disorder. It affects 5 to 10% approximately of menstruating women. And it's one of the most common causes of infertility in this country. What are the symptoms? They include the inability to lose weight, hair loss, fatigue after meals, hormone imbalances, sugar cravings. Do these symptoms sound familiar? I bet they do. They sound a lot like a fibromyalgia patient, don't they? You probably have a lot of those symptoms. So what we do is, by using blood chemistry tests, we can identify if you have polycystic ovarian syndrome. It can be identified by what we call insulin resistance. Again, insulin resistance, another term for it is prediabetes. Blood sugar levels or blood glucose levels anywhere between 100 and 126 on a fasting test. It's also indicated by elevated triglycerides and cholesterol, especially if the triglycerides are higher than the cholesterol. So if you have triglycerides that are, 250 and your cholesterol is 225. Insulin resistance is a condition in which the body's cells become resistant to insulin, usually due to a high carbohydrate diet. What happens is this leads to excessive testosterone production, actually, in females. They'll get too much testosterone, which will lead to the polycystic ovarian syndrome. What happens is, as testosterone levels rise, the cells become further resistant to insulin, and it's kind of a slow downward spiral, which many of you are familiar with, and most of my patients are familiar with. Cell resistance to insulin, so when a cell is resistant to it, then in turn promotes testosterone elevation. This just keeps going. So the insulin resistance increases testosterone, testosterone increases the insulin resistance. The insulin resistance will also promote systemic inflammation all over your body, and immune problems, which predispose a person to immune disease. You factor in all of this with someone who may have an autoimmune thyroid condition like Hashimoto's, and now you can see why it's important to address polycystic ovary syndrome with someone with fibromyalgia. No? Can you see that now? So that's it for this one, this success secret. I hope you enjoyed it, and we'll see you next time.